I'm here today with Dr. Doug Foster, spine surgeon from the Great River Spine Clinic in Burlington, Iowa. Thank you for being with us here today, Dr. Foster.
Thank you.
Suppose we start out a little bit by you telling us about your background and training.
I went to medical school in Georgia at the Medical College of Georgia. And when I finished there, I did my orthopedic surgery residency training in Shreveport, Louisiana at LSU Medical Center. And then I went to did my spine fellowship in Los Angeles, California at USC Downey, which the hospital there is Rancho Los Amigos. And since then, since 1991, I've been in private practice doing spine surgery.
How many spine surgeries have you performed?
Trying to be accurate about this. I've been asked this question before. I would say if I've been doing it for 20 years, which I have, on a minimum of probably 300 surgeries a year. My math skills aren't that good, but it's more than 100. So.
Are there any particular procedures you do most?
I think I do, as far as procedures, what most spine surgeons do most, and I do most too, is decompressions. Relieving nerve compression, leg pain or arm pain. That would be what most of us do, and me too.
Why is the spine so critical to physical well-being?
It's the basic blueprint of all life, essentially. You know, when you look at animals, they divide them into two classes, those that have spines and those that don't have spines. And they actually call that true spines. I guess there's a false spine. If you took a human spine and shrunk it to the size of a mouse spine, it would really look very similar to a mouse spine. And if you took that same human spine and magnified it to the size of a whale spine, it would resemble a whale spine quite strikingly too. So there's a grand design in all that seems to have withstood the test of time. More people, it's not just me that's interested in it, obviously. It's also a basic foundation of your body. It's how your arms and your legs are attached. It serves as a basis for your head being attached, your pelvis attached. It's called the axial, or the center of the skeletal system. In addition to that, the spine is a conduit where the nerves, wires, spinal cord, which is the brain in a way, transmit their impulses to make your arms move, to regulate your heartbeat, to control your intestines. All the functions in your body are somehow managed by the spinal nerves as well, as a rule. I think it's very important.
Could you explain some of the general construction of the spine?
Like I said, in whales and mice and men, they're all the same. There's a bone, which we call a vertebra. It's sort of rounded, disc-like, really large disc in front, and in back there's a hole. And through that hole in the back of the spine, or the vertebra, is where the nerves or the spinal cord pass. And one bone or vertebra is stacked on top of another. So you have a series of these stacked together. And between each disc or vertebra is a disc. And a disc is really more like a bushing. It actually grows into the bone or vertebra above and the bone or vertebra below, so that it actually anchors the two together. But yet it's flexible enough that it allows motion in the spine. And through that, the nerves or the spinal cord will pass. There's openings on the side of the spine where the nerves exit, and depending on which level or area in the spine is, would determine which nerve exits and where it's going to go. So there's sort of like a grand wiring diagram for nerves that come out of the spinal canal. The blue, green, red, black wires that people talk about in the old days with TV sets and radios. Nerves are sort of like that. The C6 nerve goes to one particular part of your arm. Lumbar nerves in different areas go to specific areas of your legs. So all that really just sort of has to do with the anatomy. When we talk about spine and parts, we sort of give them addresses so that when we talk to somebody else, we know what we're talking about. The cervical spine is the neck. That's essentially what it means. The thoracic spine is the part of your spine where the ribs attach. The lumbar spine is your back. That's really where people talk about the lower part, the low back.